What is the full form of HIC as per NABH? Hospital Infection Control. Which license is mandatory for hospital kitchens under NABH? FSSAI license. Which unique number is given to every patient under NABH? Unique Health Identification UHID. Who grants NABH accreditation? Quality Council of India QCI. What does CSSD stand for in NABH standards? Central Sterile Services Department. What is the full form of NABH? National Accreditation Board for Hospitals and Healthcare Providers. Which organization governs NABH? Quality Council of India. What is the main objective of NABH? To improve quality and patient safety in hospitals. How long is NABH accreditation valid? 3 years. Name one key benefit of NABH accreditation for patients. Safe and quality healthcare. Which year was NABH established? 2005. What is the minimum bed requirement for NABH accreditation? No minimum bed requirement. Which document guides NABH standards? NABH accreditation standards. What is the highest accreditation level under NABH? Full accreditation. Which committee is mandatory in hospitals under NABH? Hospital Infection Control Committee. Which committee monitors safe use of drugs in NABH hospitals? Pharmacy and Therapeutic Committee. What is the retention period of outpatient records under NABH? 5 years after the last visit. Which infections are monitored as quality indicators in NABH hospitals? VAP, CLABSI, COTI, SSI. Who is responsible for the hospital-wide safety program in NABH? A designated safety officer or in charge. What is one key quality indicator in the front office? Average waiting time for admission. What should be displayed at a prominent place in the hospital? Mission and vision statements. What license is mandatory for handling biomedical waste? Authorization from the State Pollution Control Board. Who must approve the hospital organogram? Top management. What training must every new staff member undergo? Induction training. How often should staff retraining be conducted? At least once a year. What type of flow should a hospital kitchen have? Unidirectional flow. What is the retention period for inpatient medical records? 7 years after last visit. What is the retention period for medico-legal case records? For life or until Supreme Court judgment. What should biomedical waste bins have for proper segregation? Color coding and biohazard logos. How should narcotic drugs be stored? Under double lock and key. What are the key requirements for admission procedures under NABH? Documented SOP for all types of admission, OPD, emergency, transfer. Policy for handling cases of no bed availability. Clear process for admitting unidentified patients. Training of admission staff to follow policies correctly. Proper documentation maintained for every admission. What are the responsibilities of hospital management under NABH? Develop and approve an organogram showing chain of command. Ensure statutory licenses like BMW authorization, fire license, AERB, PNDT if applicable. Designate a responsible person for hospital-wide safety program. Provide resources for quality improvement. Monitor compliance with legal and regulatory requirements. What are the responsibilities of a patient according to NABH standards? Responsibility to provide accurate information. Responsibility to follow treatment plan. Responsibility to ask questions if unclear. Responsibility to respect hospital staff and others. Responsibility to adhere to hospital rules. Responsibility to pay bills timely. Responsibility to provide insurance details accurately. Responsibility to avoid self-medication. Responsibility to attend appointments on time. Responsibility to maintain privacy and confidentiality measures. What are the quality indicators for hospital infection control according to NABH? Catheter associated urinary tract infection rate, ventilator associated pneumonia rate, central line catheter associated bloodstream infection rate, surgical site infection rate, needle stick injury rate, percentage of staff provided pre-exposure prophylaxis, hand hygiene compliance rate, patient fall rate per 1000 patient days, hospital associated pressure ulcer rate. What are the rights of a patient according to NABH standards? Right to respect and dignity, right to privacy and confidentiality, right to information on healthcare needs, right to informed consent, right to access medical records, right to second opinion, right to information on expected costs, right to complaint and readdressal, right to safe and secure environment, right to non-discriminatory treatment, right to choose doctor, right to education about condition and treatment. What does SSI stand for in NABH standards? Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.